The question is, can homeopathic and allopathic medicines can be taken simultaneously for better control of psoriasis? There are two parts of it. One is yes and one is no. First of all, let us talk about why no. So whenever a patient comes to me for a psoriasis treatment, he has a psoriasis on his body, and first thing when you start homeopathic treatment is main at the treating of a tendency, and as the tendency goes away, gradually the symptoms go away. So we do not do anything to control the appearance of the psoriasis. The internal improvement in the tendency will result in the external appearance, whereby the patient is concerned about the itching and the appearance. And the modern medicine or allopathic medicines are very fast to remove the psoriasis on the skin, and patients are very interested in it, or they are happy about it. And they are unhappy about homeopathic treatment because it takes time to disappear the skin symptom. So the question comes that, can I take both the treatment at the time? No. Why no? Because if you are taking my treatment and also applying allopathic ointments controlling your psoriasis, after a month or two when I go for follow-up, I am not able to know that whether the psoriasis, what is the result of my treatment, whether my treatment has helped him or not, because already the psoriasis has disappeared because of the allopathic treatment. So I ask them to stop the treatment initially, so that even if it increases, because naturally if you stop allopathic treatment, definitely it will increase. And let me start from there. So whatever the result of my medicine, after giving my medicine, if I notice that after 1 or 2 months the symptoms are less, that is the result of my medicine. Or if I notice that after giving the treatment of 1 or 2, the psoriasis again increases, so that is also maybe because of my medicines. So I have to manage my medicines according to the results or according to the reaction of the patient. So that helps me to take the patient free from psoriasis or cure the patients, even if sometimes it may be that he is in a trouble or he has to tolerate for some time. So then I always say no. Whenever you start treatment of psoriasis, start with one treatment only. Don't mix 2-3 treatments at the same time, because none of them will be able to know what is the result of their medicines. Number one. Number two, yes. Why yes? In a very rare situation, I do also advise the patient to take my treatment as well as allopathic treatment. Where? Number one, whenever there is a cellulitis or very severe secondary infection in the patient, and it will be difficult for them, or there is also possibility of complications in the patient. At that time, I say don't take a risk. It's the best way, allopathic treatment, take antibiotic, control the infection, cellulitis, or you can stop my treatment for few days and again you can start it. This is very essential. The second scenario comes that whenever patient starts developing psoriatic arthritis. So if it is a psoriatic arthritis and there is an inflammation of their joints, and if it is not controlled in the shortest possible time, so the joints may fuse. So if I treat only with homeopathy, because by the time I treat the patient in 1 year or so, his joints will be deformed. So what is the use of my treatment of psoriasis when the joints is deformed? So there I say no. Here I have to compromise. I say you start allopathic treatment to control your psoriatic arthritis inflammation and the pains. And at the same time, continue my treatment to control the tendency of psoriasis and psoriatic arthritis. As gradually I notice that the inflammation of the psoriasis joints with allopathy is controlled, but gradually I notice, I ask them to stop the allopathic medicine step by step. That is a taper down. So even if patient minimize the doses, the psoriatic arthritis is not affected because my medicine has taken care of it. So that comes a time that complete stoppage of allopathic medicine, no psoriatic arthritis, the joints are also free. Although it may take almost a double time than the normal treatment, but I have saved the joints also, I have treated the patients also, and he is free of all the treatments including my treatment. So that is the best strategy I use in a very rare exceptional cases. So it depends on the patient whether they have to take 2 treatments at a time or not. Whenever I advise, it is must, and whenever I say no, it is a choice. So definitely I always give a choice and preference to my treatment whenever possible. Thank you.